The China Current is honored to partner with AIDS 2020 Virtual, the world's biggest conference on global health. In a time of COVID-19, its leadership on science, policy, and civil society is needed more than ever. From fighting stigma to funding research, the conference puts a focus on health and how it impacts the way we live. For the opening of AIDS 2020 Virtual, I was humbled to interview Sir Elton John, David Furnish, Dany Stolbunov, and Winnie Byanyima. Here, we would like to share some of those conversations with you. Dany, thanks for being with us for the opening of AIDS 2020 Virtual. It's a great pleasure speaking with you. So let's jump right in. You're 22 years old, you live in Ukraine, and you're an activist. But what does an activist mean to you, and how did you become one?
Thank you, James, for the question. And it's an honor for me to have my word on AIDS 2020 Virtual. Unfortunately, we didn't met offline, but next time maybe. So thank you for your question again. Being an activist in Ukraine is quite a complicated matter. I don't know why, but I presume that due to the fact that our country went out from the Soviet Union, and we still, on the mental level, have those totalitarianistic approaches and thinking and so on. Unfortunately, being an activist still, it's being on the top of the fight, like a revolutionary. You have to every day protest, every day punch them. I mean, people who make decisions for them to make decisions that you need, actually. And being an activist here, when you punching and punching and punching, and not all the time receiving the results, not all the time you can touch the result. You face 7th grade level emotional burnout, as we call it here professionally. But that's just kidding. Most of my colleagues and me, they are quite encouraging and inspiring persons, because they're standing hardly for people's lives, for people's health. And what shaped me into 4 years of doing all this protests, meetings, mails, and so on. So yeah, it feels okay.
Dany, you're a first-hand witness to the stigma that continues to block access to healthcare for people living with HIV. What do you think it's going to take to end discrimination amongst medical professionals?
Very complicated question, actually, because firstly, healthcare providers are a very special sort of people, and it's not depending on their diploma or education. All the people here in Ukraine and other countries of ICA region, unfortunately, again, due to historical reasons, are living in the human rights ghetto, and all the minorities are facing that or those kinds of social stigmatizing. Even myself, when I went to a local hospital to be permitted to study in a medical college, they told me no, unfortunately you can't be a doctor because you're a big threat to people, but on the same time, by the law, I can be the medical worker. So what can I say is, we can work a lot with adults here. We, of course, need to provide nationwide campaigns and social experiments and all that stuff to change their attitude to people living with HIV. But I say that here, what we face in teenager work, that we are counting and working with young people, because youth is our big priority, because in the future they will be our healthcare providers. They will be our social health providers, and we can lower stigma in adults here, but it is quite a complicated matter due to mental features. So we need to work hardly and every day on young people, educate them first.
Well, thank you for sharing that story. It pains me, though, to hear that you were told by your own doctor, someone you trust, someone that you aspired to be, that not that you were not good enough, or that you were not committed enough, or that you were not smart enough, but that you were a big threat to society and therefore could not be a doctor like your doctor. How did that feel when you were told that?
Well, I had a dream to become a medical student from 8th grade of school. Yeah, it was quite a big dream. And when I heard it, it was the first time I faced this big discrimination. It was quite stressful because why in the hell I can't be just because my status. So, but then I realized I shouldn't really care of words they say to you. Like no one actually does because they're wrong. By the law, you can be, and that's their just personal points of view, which I should not count with. So, yeah, I overcame it psychologically, and in 1 month, I became a medical student.
Well done. Now, you live in the region of Eastern Europe and Central Asia that is seeing the fastest growing HIV epidemic anywhere in the world today. I'm confused. Why are we seeing falling HIV infections in some parts of the world, but where you are, we're seeing the numbers go up?
James, again, due to totalitarian approaches in the heads of people who are now doing some policies, doing politics, it's just a very big lack of political will and the right principles of people. Because here in Ukraine, when during COVID-19 and so on, the Minister of Healthcare wants to earn lots of money and block in the transparent procurement. So what can we say about the rest of them? In Russian Federation, there's a big problem with criminalization of drug users who are getting to prisons and getting infected there with TB and hepatitis C and so on. In Kazakhstan, medical workers are not that professional because they are infecting kids with just medical injectors and interventions. That's so it depends on country very much, and so I would say that there's a big difference. I mean, South Africa and other African countries realized for 5 or 10 years ago that people's lives and health is the priority number one. Here, we still all we have as a community is made by this community, by the fight of civil society, not by people who make decisions. So this kind of fight will continue until new generation of principled young people will get the highest position to take decisions in the side of people living with HIV.
Dany, we keep saying that the voices of young people like yourself are so critical. So how do we guarantee that young voices are heard and heard at the highest levels as you're doing at this AIDS 2020 virtual?
Firstly, we have to be super honest with young people and with global world, because we often say that young people is the driver to end AIDS epidemic, but we oftenly not doing the things to support that words, right? Sometimes it's just words. And for global donors, for global leadership community, governments, agencies, there is a very important step for the next years to realize that when they will be a bit elder, only youth will be able to change their seats. And for now, they should do as much as possible investments in growth and development of youth communities, and especially in Eastern Europe and Central Asia, because here there is no one who is really prepared to work with young pops, HIV epidemic, harm reduction, and so on. So we should stop saying that oftenly, but working to make youth real leaders in the future right now.
Dany, I tell you why it's such a privilege talking to you, because when I hear you, I know that I'm listening to the present and to the future. So tell us this to end off with. What's it going to take from all of us to truly end AIDS?
From all of us, from person by person. I'm not in the position to tell everyone what to do, of course, but firstly, it is quite obvious, testing. Just go and get tested. Take condoms and use them. Secondly, find a person which is living with HIV, just, hug her and tell her, whatever you need, I can help you with it and I can protect you. Because especially here, adolescents who are moved from occupied territories or living without one or both parents, they lack psychosocial support and they're left behind the general attention. Support people who live with HIV just be near with them. And the third one, I would say social donations. If you really want to support the HIV community globally, just donate some money to them, and they will do best to use this money for social changes.
Dany Stolbunov, thank you so much for speaking at this AIDS 2020 virtual opening ceremony. And thank you very much for allowing us to learn from you.
Thank you very much, James. Thank you. It was an honor to speak with you.